this thing is not just about government alone. This is about everybody working together to make sure that all of us are safe. If we don't do that, what we'll end up with is the numbers would continue to increase, and we'll see more cases of hospitalization and more cases of deaths.
That was Minister of Health, Dr. Frank Anthony, during Thursday's COVID-19 update. According to the new gazetted COVID-19 regulations, persons visiting malls, supermarkets, restaurants, places of worship, and other government buildings must provide proof of vaccination or a negative PCR test before they are allowed entry. These stringent measures have come in for harsh criticism from a significant cohort of the population, including sections of the religious community who opine that the stipulations impinge on their constitutional right to gather to worship. Protest actions have also been the order of the day since the new orders were announced. Dr. Anthony is, however, unstinting in his view that though strict, the measures are an absolute necessity given the unprecedented daily uptick in COVID-19 new infections, hospitalizations, and deaths attributed to the local presence of the deadlier and more easily transmittable Delta variant. As of Thursday, there were over 1,000 active COVID-19 cases in Region 4, whilst over 800 cases were recorded in Region 3. More so, in the last 24 hours, the ministry recorded 308 new COVID-19 positive cases, while 150 persons are now hospitalized at various institutions across the country. If this trajectory continues, the primary healthcare system will need to be reprioritized.
Maybe non-essential kinds of services, we'll have to close those and redeploy staff and resources to treat with the severe cases. So we have a number of contingencies in place, and we'll activate them as is necessary.
The minister reiterated his plea for Guyanese to take the jab, especially older persons who suffer from hypertension, diabetes, and other chronic ailments. At present, there are 341,600 adults who have received a first dose of the COVID-19 vaccine, while 176,695 adults have received double shots. Almost 20,000 adolescents are now vaccinated. And even though an estimated 17 schools have been forced to close their doors following COVID-19 outbreaks among teachers and students, word from the nation's health minister is it's not an unusual occurrence.
And with cases on the rise, it is not unusual to find cases in different institutions.
After more than a year of primarily utilizing the online learning modality, more than 40 nursery and 44 primary schools reopened their doors for face-to-face learning on September 6. The rationale of this move in the midst of the raging Delta strain was heavily criticized. However, Education Minister Priya Manik Chand, in juxtaposing the extreme knowledge deficit suffered by the country's student population during the last year against the long-winded nature of the COVID-19 virus, took the decision to open schools whilst promoting vaccination as a risk-reducing measure. Not surprisingly, the intermingling of teachers and students presented the perfect scenario for the SARS-CoV-2 virus to have its way, and days after school reopened, the reports began to filter in. Teachers and students were falling ill. So what's the way forward? What's the solution? Well, according to the health minister, the situation can be curbed if basic measures are adhered to.
You've got to come back to basic measures: vaccination, social distancing, masking. These are your basic measures that you have to use.
For HGP Nightly News, I'm Melanie Morris.